Happy Sunday, happy Sunday, happy Sunday. I am Brianna Smith, formerly known as Nurse Bree, and now I am your favorite certified breastfeeding counselor. I want to talk about the influences of a mom perceiving breastfeeding as hard, especially within the first hour after birth. The three main influences is your uncomfortable position that mom is in, the latch, and understanding your baby cues. So first thing is first, breastfeeding is layers. This is not going to apply to every mom. I'm targeting moms who just had a delivery vaginally and baby is doing fine and thriving, okay? First thing you want to know is that skin to skin helps initiate this process. When the baby is lying on you, bare chest, with your baby who is also bare, with blankets, that initiation of skin to skin is so helpful with baby and for you to breastfeed. The placenta, which was the organ that is now out of your body, was taking care of baby. The placenta was taking care of baby, and the placenta gave baby enough up until delivery. So the baby's size is the size of stomach size is the size of a cherry, which means the baby doesn't need a whole lot within the first hour, okay? When the baby is giving you signs, which is rooting and suckling fingers and stuff, that is saying I am ready to start the breastfeeding process. I have this pillow behind my back because if I quickly, this is Ruby, by the way, if I quickly throw my baby on the breast, right, and I don't have a pillow behind me, I'm going to do this. I'm going to do this shoulder lean thing. Something about moms doing that. I don't know why they do that, but stop doing that. It's natural. You want to hurry up and give the baby what they need, but you don't need to do that. All you need to do is say, am I comfortable? That's the first question you want to ask yourself. So when you position that pillow behind your shoulder blades, you're more relaxed. I would have, in a perfect scenario, I would have a bobby or a pillow here, or even something to rest my wrist on because it's tiresome for you to maintain a position. Okay, I like the football position, just like that. A lot of moms, the second thing that I notice that a lot of moms do is place their hand on the baby's head. And although this may look like I'm securing my baby from doing that, that's not always helpful. So within the position of football, I would place my dominant hand, even if it's this side, on the baby's back. You see how I'm supporting my back with this pillow? I'm more erect, right? You want to create a space where that baby can, be more, I call it the head tilt position, right? When your baby is sealed with the palm of your hand, it makes their head kind of slightly rely on your index finger and your thumb, exhibit A and B, right? So that way the baby won't fall off because I'm securing Ruby. Ruby ain't going nowhere, right? So I have the pillow here. I have everything I need to support Ruby. And this also helps Ruby remain close to me. When Ruby is close to me, she has a good latch, which is the second reason why moms say, I don't want to breastfeed within that first hour. Ruby needs to be this deep. That's like an inch. This is a nipple shield. That's like an inch of my breast. It should be on inside Ruby's mouth because the areola, the dark portion of your breast, is where all of that milk is coming from. Not just the nipple. The nipple is just the sphincter that it comes out of. She needs to be deep on to it so that she can get all of the colostrum, which is the first, that's the pre-milk before the real milk. The real milk doesn't come in until 3 days later. Okay, that colostrum is good for antibodies. That skin to skin is good for temperature regulation, pulse, and body temperature. I said it already. Temperature regulation, vital signs with baby. That breast milk, exclusive breastfeeding, is good for neurodevelopment. It's so rich in antibodies. That little bit of drop, that little bit of colostrum, though, that clear, sticky fluid is so good for baby. And then 3 days later, you will have a real, more yellowy color of milk. So we already talked about the position. We already talked about the latch. And I know your next question is my baby getting enough? Yes, your baby's getting enough. Within 24 hours, your baby should have at least 1 pee and 1 poop pamper. So I hope this is helpful with understanding the barriers, the initial barriers of breastfeeding amongst baby and mom immediately after birth. It's overwhelming. You're like, I don't even know how to hold my baby. I'm scared I may hurt my baby. I'm shocked that I'm a mom. There's so many reasons and there's so many layers to it. This scenario may not be applicable to you in your unique situation. I'm challenging you to have a different perspective and narrow down the basics for your own foundation. I hope this helps someone. Remember, you're doing a good job.